Hello, good morning, good afternoon, whatever it is for you, wherever you're sitting. My name is Grant Fritchey. I work for Redgate Software, and we are going to talk about HIPAA today. If you've got any questions as we go along, please feel free to take advantage of the GoToMeeting technology. There's a questions window there. I'll keep an eye on that, and you can ask questions there, and we'll bring them up as we go along, and I'll try to answer them within the webinar itself. Now, moving on, our goals today. I want to bring up why people are talking about privacy and protection so much. I mean, it's becoming a big deal. I mean, it's just there's just more and more discussion around it. It's not limited to HIPAA, but HIPAA certainly has major impact on privacy and protection. We're going to drill down on HIPAA in general, talking about the basic classifications of the data. And then we're going to talk about methods to deal with it, specifically methods to deal with HIPAA that are somewhat applicable to DevOps. The concepts of DevOps are not limited to or separate from any sort of data privacy and protection. In fact, most of the things that we do with DevOps, in and around DevOps, actually leads to better privacy and protection. So, I mean, it's just all something we want to try to strive for. So this is the general idea, general gist of the day. This is what we're going to chase down. Now, the thing is that we are seeing more and worse data breaches all the time. It's constantly happening. And further, as you can read the quote there, the data breach itself is not, the problem. It's what happens afterwards. The fact that that information is out there forever. It becomes more and more of an issue, especially when we're talking about the kind of information that HIPAA covers. And we'll get to that in just a bit. Now, we've got the records from 2017, and we can really safely say, based on the number of breaches, the number of records that were breached, and partly this is from reporting, not simply because of the number of breaches. It is partly from reporting, but it's not completely from reporting. We can say that 2017 was the worst year ever, although 2018 looks like it's on its way to beat it. In 2017, we saw a 24% increase over 2016. I mean, and that's crazy when you think about literally billions of records getting exposed through various types of data breaches. I mean, it's crazy. With almost 90 of the breaches that are reported, and again, there may be worse breaches out there that we just don't know about, but that with almost 90 of them exposed more than 1 million records each, which is, again, just insane. And the fact is that 8 breaches in 2017 made the top 20 all-time breaches, which is, again, more ammunition on the idea that 2017 is the worst year ever. I mean, the only way I can put it is that we are not doing a very good job managing our data, that we need more mechanisms, more processes in place, because we have unintentional exposures accounting for 68% of those things. In short, only 32% were direct hacks. It was either we accidentally sent things out, we had just massive holes in our portals, or we had completely misconfigured our systems. All of these things lead to the fact that we were looking at most of the breaches are coming from outside of our organization, but a lot comes from inside the organization, which is just nuts. And all of this was in a 2018 report that you guys could look up there based on that link. And the thing is that in 2017, it was very frequent that we were seeing these kinds of breaches. Now you can take a look at the information that we have here, and it's not a pretty picture. The emails, okay, fine, that's the number one, but passwords are number two. And passwords leads to all the rest. Your name, your physical address, your social security card, all of that information starts leaking out. And then it's not only possible for them to hack, but it's also possible for them to sell that information to others. Every bit of this is actually covered under HIPAA, believe it or not. Personally identifying information is not just the medical stuff, but it's also the billing information. And the billing information includes email, physical address, social security number, the credit card numbers, and all the rest. So, yeah, I mean, we are worried about the contact information, and certainly that's a real issue. But more important for a lot of us is the fact that our government IDs are getting leaked out. The fact is that we're seeing things like our birth date, our place of birth. These things become verifiable locations that allow people to then get at our information in more and imaginative ways so that they can then attack things like our credit cards and, frankly, HIPAA. We are worried about our medical records. We don't want things like our procedures, our prescriptions, our test results just getting transmitted to anyone. And certainly not even the geolocation, our cameras, our information, and our online browser history. Every bit of this information is getting leaked out, or we are leaking out the information that allows us to track down this information. Now, if we just take a look at a summary of breaches that were occurring over 2017, just a rough overview of the kinds of things that are going on. The fact is that 75% of the breaches were from outsiders, but more than 50% of all the data breaches can be attributed to errors. It's us. It is on us. We're doing things like giving the wrong people sensitive data. We are doing things like publishing to the wrong location. For example, and this was in 2016, but I know of an organization, it was a spam company, but they accidentally put an unencrypted backup onto a public website just by accident. It was just a mess up. And so the kinds of publishing errors that we're seeing are on the rise. And we're making simple, mistakes on data disposal, which becomes a much bigger thing with the GDPR and with CPP and with the shield law from New York State if it passes, and certainly the information that's under management from HIPAA. And frankly, we're making errors in our code. I don't want to pick on any individual out there. I'm just saying as IT people, we're not doing a good job. We're making errors that we shouldn't be making as IT individuals. And, all of this stuff is adding up to more and more leaks. And the thing is that in 70% of the places, the customer is pointing out what happened. It's not that we are monitoring properly. It's not that we are keeping an eye on things so we know what's happening. Our customers are tracking it down for us. And so there you can see the actual breakdown on where the breaches are coming from. And again, 75% from outsiders, 25% from internal, or 18% from state affiliated actors, literally other governments attacking our information, which is just crazy when you think about it. And so the tactics used is also interesting because it does break into what's going on. 62% straight up hacked. Okay, fine, easy enough to deal with. 51% used malware to get by, or 81% making their way in through leaked or stolen passwords. And it's kind of happy to see only 43% were social attacks, which is better and better every year. People are clearly becoming aware of what's going on. And this is all based on information that was given out by, what's going on here? Come on. There we go. Was all information given out in a Verizon report. Now, before I give presentations like these, I like to go to privacyrights.org because they have an ongoing track record of what's going on, who's been hacked, and it's based on certain reports. And in this case, there was Interact of Michigan in October, on August 7th, had a hack, and it was a medical hack. 1,290 records breached, email only. Now that's good news. It's only email. It's not the billing information, stuff like that. However, this is still part of the information covered under HIPAA because this is, personally identifying information. This is the kind of thing that we are supposed to be protecting against. And we can see that a very recent hack occurred. Now, I go to another place on a regular basis to see the news reports, and that's databreaches.net. And this shows, this is a news report from August 21st, brand spanking new, yesterday, I believe. 21st is yesterday, it's 21st today. Oh, it's today. Okay, so cool. Like I said, I check these things before I do these kinds of presentations, just so I know what's going on. I mean, I really do keep a close eye on this stuff that's happening. And in this case, 38,000 direct personal information was hacked. Now, this occurred back in May, but the information is getting reported now. And so this is a nonprofit health system, and they let out all the information. It didn't get discovered for a month, and it wasn't even disclosed until just this week. It's just incredible, the things that we are dealing with, the amount of hacks, the amount of breaches that are occurring, and and the fact that they're just getting worse and worse every day. And they are all directly, well, not all, okay, all is a big word. I apologize for using that. There are a lot of them directly related to HIPAA. The most recent report from both of the websites that I read on a regular basis were both HIPAA related. Now, the cost of breaches is a constantly growing threat because there's fines associated with it, and you can just go out of business if you lose your data, or if you're sued, or if the business finds you. I mean, it's just nothing, is cheap or free. It all goes up. The latest report from this Juniper research thing is by 2019, it's going to be a 2.1 trillion loss to business. I mean, and that's rugged. The average worldwide it's 3.62 million. With an average loss of 24,000 records. I mean, and we saw that from the previous hack. It was what, 33,000. It's fairly common. The highest average cost on the hacks for is America, and it's at $7.35 million. Now, I mean, some of our organizations that we're working with, $7 million is, a drop in the bucket. They won't even notice it. But some of our organizations, that is the organization. The really creepy thing is there's a 27% likelihood of a material breach occurrence within 2 years. In short, if you're doing things incorrectly, if you're making mistakes now, chances are very high you're going to continue to make mistakes and not clean things up. So, I mean, that's a painful reality to deal with, but it's true. The other interesting thing is it breaks down per record stolen as $141 cost. Now, that is an average across all different kinds of industries. So some industries may be quite a lot higher. So if you look at it, look at that. Healthcare, the number one cost. I wanted to make sure we got to the industry itself. And a material data breach is one in which at least 1,000 records were lost. That's worth noting. But you'll see it right there. While the average is 141, healthcare is more than double that. More than double the average cost per record stolen. So why do we care about this? Because the cost of these things is going up constantly. And the thing is it's not simply about the legal fees. I mean, I wish it was only the legal fees, but it's the fact that your brand is hurt. No one trusts you anymore. Also, the fact that, if you're trying to deal with the breach, you're not doing work. You've got to, you're spending time doing that when you should be spending time setting up HA, DR, whatever other kinds of new development you've got going on. And you're losing money. And the fact is that all of these things add up over time, and it literally hurts the business directly in the most direct possible way on your money. And so when Yahoo was bought by Verizon, they saw a $350 million reduction in the purchase price because of that $1.5 billion record leak. Anthem did a $115 million settlement when they had that breach that affected 80 million customers. I mean, and you think about that, that's only, what is that, $1 million per customer? That's no big deal. Oh my gosh, that's crazy. So the thing is we're seeing more and more regulation coming in response to the fact that we're not nailing it, that we are missing the boat, that we're not getting things done correctly, that we in IT are not succeeding in the way we need to succeed. So the government is coming in and telling us what we need to do. It's getting hard, and there's more and more coming. It's not going to slow down in any way, shape, or form. While we've got, the GDPR, and if you haven't looked at the GDPR, I very strongly recommend you do. Even if you don't have data under EU citizens' data under management, the GDPR is being modeled by other regulations coming out. California passed one. It's a brand new law. Enforcement starts January 1, 2020. So we've got a little while to get ourselves together, it being 2018 and all, but they've passed the law, and it is modeled, the CPP is modeled off of GDPR. New York State has the SHIELD law. I'm not going to go and look up the acronym for you right now, but it's coming, and it is also modeled off of GDPR. I understand North and South Carolina are exploring setting up a law based on the GDPR. Multiple other countries are also setting up GDPR laws. And since, like HIPAA, the GDPR laws directly apply to individuals, to people, and the data under management of people, that means that while we're having to deal with HIPAA, we're also going to have to deal with GDPR. And so these things, these data privacy and protection regulations, are coming more and more. And so we've got things like the PCI, the Payment Card Industry Data Security Standards, which, if you're working with credit cards within your healthcare organization, even though you're covered under HIPAA, you also have to meet PCI compliance. The EU NIS directive from 2018, that covers a lot of the EU data, largely more of a business data, whereas the GDPR is individuals. We also have the South Africa Protection of Personal Information Act, POPI, which is going to become enforceable later this year, maybe early 2019. It's kind of unclear exactly when that one's coming, but it is coming, so we need to keep an eye on it. Now, China has passed a cybersecurity law. That's also going to affect us. The Japan Amended Act on the protection of personal information. And Japan is also working to expand this towards a GDPR-style individual regulation. You got to remember, it's all about whether or not we're talking about regulations such as Sarbanes-Oxley or SOX, which is for companies, or whether we're talking about individuals such as HIPAA, where it's covering people. And the GDPR and HIPAA are very much focused on people. Now, the New York Department of Financial Services just passed the cybersecurity regulation, but they are coming out with that SHIELD law soon. That's going to be a little different. We also have, in 2009, there was the high-tech amendment to HIPAA, the Graham-Leach bill in 1999, the UK Data Protection Act in 1998, and it's just going on and on. Now, Redgate has done a data governance implementation survey. Now, we did it this year. You guys can take a look at it. That's available. And the interesting thing is that what we found is that 77% of all the businesses we talk to have either implemented a data governance program or plan to do so in the next 2 years. And that 44% said that regulation is the primary driver. Now, 72% work in organizations that are subject to legislation or regulations such as SOX or HIPAA. So HIPAA is absolutely applicable. And there's a substantial portion that know that they are subject to the GDPR, even though they reported to us that 37% of them have EU citizens data, which means they are subject to the GDPR. So 27 self-reported, 37 should have reported. I mean, I find that fascinating. We've got a large number that says that they are looking to DevOps because only 5% said it had a negative impact. I mean, that's the the gist of DevOps, the gist of adopting automation is that it doesn't hurt. It almost always helps. And most of the successful programs are using tools. The unsuccessful programs were not. So tooling becomes a big deal. Now, if we take a look at just a general overview of HIPAA, the interesting thing is that HIPAA has fines associated with what you're doing. If you have data breaches, the fines can be up to $250,000. Now that can be per data breach. So how they define the breach is where things get fun. But they can also come after you and put you in prison. And so that's usually, a monetary fine for your organization. Yeah, that's kind of scary. But that prison sentence, that could be on us as data professionals. If you look at how the law is written, it is very ill-defined who it is that they're coming after. And a big thing about the law is it uses a very specific term, mens rea, with knowledge. And it is basically if you with knowledge expose information through HIPAA, you can be in trouble. And so it's not a question of if or when, it's a question of if you've done the exposure. Now excuse me, one second. Sorry about that, had to cough. My allergies are acting up. So they've expanded it more with the HITECH Act, and HIPAA was enacted in '96 with the privacy rule in 2003, the security rule in 2005, and then HITECH added in 2009. And it really did widen the scope of HIPAA. It made it a lot worse, and it increased the legal liabilities. And the thing is that it covers pretty much everybody who's doing things with medicine. And they've said that if you don't correct the violations, while they may only fine you up to $250,000 per violation, if they're uncorrected, then it goes up to $1.5 million. Now, the thing is HIPAA is divided up into 5 sections, and they're called titles. And most of the titles are talking about all kinds of things that are not directly related to us as data professionals. So for us as data professionals, we are very focused on HIPAA Title II, the second section, because, oh, and by the way, the name of that second section is called Administration Simplification, although I do find that it's anything but simple. The administration simplification is divided up into 3 basic rules. There is a privacy rule, there is a security rule, and there's an enforcement rule. And I just want to drill down and talk about each of those for a couple of minutes just to kind of, set the stage of what we're dealing with here. Now, the privacy rule is very, very simple to understand. It's talking about personal health information, PHI, which by and large is a lot like PII, personally identifying information, but it's very focused on the medical record. So the fact that you're on statins, for example, is not necessarily personally identifying, but it is a part of your personal health information. And so leaking that, is a breach. And so there's a problem. But PHI, personal health information, also includes your payment history and therefore your payment information, credit cards and all the rest of that stuff. So even if you weren't required to protect information based on PCI, the credit card group and the credit card regulations, you are required to protect it based on PHI through HIPAA. So HIPAA goes after the medical records, and that's every kind of medical record, prescriptions, treatments, diagnoses, everything, and the payments. And we need to be very clear on this point. They have defined over and over again the words minimum necessary. And it's used again and again and again when referring to the data, the minimum necessary exposure. So I know that other organizations have tried to say, well, we're only allowed to have authorized personnel look at the data, so we'll authorize everyone. You will be in trouble. You cannot do that. It is a minimum necessary exposure. And frankly, everyone in the organization does not need to see everything. And so you can't simply, grandfather everyone in and go, cool, we're all good. We don't need to worry about it. You need to focus on minimum necessary exposure. Now, when we start talking about PHI and when we start talking about minimum necessary exposure, and when we throw in there DevOps, we are talking about the idea that we have to deal with the fact that we want to move production data into non-production environments. But when we think about the fact that we have to have minimum necessary exposure, we cannot simply move production data to non-production environments. Our DevOps approach and our DevOps methodologies has to take into account that we are going to be making some degree of necessary changes to that data in some way to protect it and meet this privacy rule. Now, the privacy rule applicability is pretty much to everyone. If you're running a health plan, obviously, you've got health information and you've got all payment information, therefore, the rule is applicable to you. If you're a healthcare provider, if you're a doctor, and if you're managing data for a doctor or a hospital or whatever, guess what? It's applicable to you. If you're running one of the healthcare clearinghouses, I'm going to tell you straight up that it is applicable to you. And further, if you're a consultant or whatever, doing work for these people with their data or on their data or around their data, or in any way you're going to expose or be exposed to PHI information, the privacy rule applies to you. There is almost literally no way to escape it if you're dealing with the data in some fashion. Now, the actions that we have to do, it's all defined within the privacy rule, so you guys can go and look this up later if you need to. First up, you do have to define and document the roles within the organization. And you have to make sure that when you make those definitions, there is minimum necessary access. So it's, yes, the DBA may have access to the patient information because the DBA has direct access as SA to the database itself. But that probably should not be true of the development team. That probably is certainly not true of the QA team. Maybe the SAN administrators, but possibly not the system admins. Maybe reverse that. Maybe the system admins, but certainly not the SAN admins. You will need to come up with and define and document the roles within the organization. This is one of the requirements of HIPAA, is that you go through those roles and use the minimum necessary access. You also, per HIPAA, have to create rules and procedures, and it uses that exact phrase, to ensure compliance. Now, when we're talking DevOps, this is where I get excited. What's that? You want me to create processes to ensure compliance? Heck yeah, I'm going to get right on that, and I'm going to automate those processes so that I can ensure we're meeting compliance. How do you protect, the PHI? Well, we've got these mechanisms in place that back up the database, that encrypt it, that do this, that do that. And when we're doing application development, while we're looking at production-like data, we've got certain processes in place that ensure that data is clear and clean. And we're setting that up as well. Now, the privacy rule also requires you to set up reasonable and appropriate technical protection on that data. Oh, and physical too. So, having the server underneath somebody's desk in an physically unsecured environment, that's a problem. You have to set up reasonable and appropriate. I mean, that's the interesting bit. They're not telling you, top of the line. They're not telling you, the latest possible. They're not even telling you, hey, we want you to do things that are not invented yet. They want it to be reasonable and appropriate, but they want it to be appropriate. So having the server underneath somebody's desk in a place that doesn't get locked up, probably not reasonable, certainly, and absolutely not appropriate. You have to put in place mechanisms to ensure that you're meeting the requirements of the law. And those have to be reasonable and appropriate. A great way to get that done, I won't lie, is DevOps. It's the way you get it done. So now let's talk for a minute about the security rule. And by the way, just to repeat, if anyone has any questions, there is a questions window. You can type those in, and I'd be glad to try to answer them. Now, the security rule. The security rule is very clear. It talks about the requirements for security. It basically says who can have access, what kind of access can they have, and and starts laying all that stuff out. Except it doesn't get into the details. It goes off of, hey, minimum necessary. Now, it does also talk about the data integrity requirements. And by data integrity, I mean, in this case, that data cannot be lost and data cannot be unavailable. In short, if you fail to protect your data through adequate testing while deploying changes to your database, and so you accidentally lose data, that's considered a data breach under HIPAA. If you're just losing people's information, you will be in trouble. So that's one of the reasons we like to have DevOps in place for something like HIPAA, is to protect our process so that we know that we've got testing in place, so we know we're not going to breach data by destroying it. Data availability requires that the data be accessible, that people get access to their data. And yeah, you've got like a 30-day window to, if it's unavailable, you've got a 30-day window to make it available. And my gosh, if you're offline for 29 days of the 30, you've got a lot of other problems going on. But in short, it's not an onerous task that we can make data available. However, we have to make the data available. And if we can't meet that 30-day window, then we're back in a breach again. So we need to avoid these situations. I mean, and this is all defined within the security rule. Now, the security rule also gives us a number of actions we have to take. And I think the most interesting one is that they want you to write your own risk assessment. So that you're going to say, well, here's a hacking risk, here's this type of risk, here's this type of risk, and here are all the things we are doing to get rid of them. And then they want you to run that risk assessment regularly. Now, it doesn't really define regularly, but probably more than once every 5 years or 10 years, probably at least annually, maybe twice a year, you're going to want to go in and do risk assessment. Maybe you want to make a risk assessment evaluation a part of your DevOps process if you introduce changes to the system. As you make a change, you do a risk assessment. Does this change affect things? That's probably a great way to go about it. Now, you have to define who your security personnel are, who has access and control within the system. You have to create audit controls that allow you to keep track of who's making what kinds of changes. Hey, guess what? Thinking about DevOps, thinking about the idea of source control, thinking about the idea of development from source control, wouldn't we then be tracking who can make what kind of changes? And if we're stepping it further and saying, like, Servers are not servers. Servers are also code. So we have a code-driven server deployment process, a code-driven server update process. Wouldn't that then fall under DevOps? And wouldn't we have that code under source control? And couldn't we then have additional auditing in place to ensure that we're meeting the HIPAA requirements of audit controls and protection methods? I mean, it's just, it all wraps back around that I look upon it as nothing but opportunity. The requirements of the compliance tells us we must create processes. Well, heck, we want to create processes anyway, right? We want to ensure that we've got the right kinds of backups in place. We want to ensure that we've got the right security protections. We want to ensure that we've got testing. We want to ensure that we're not leaking production environment and non-production systems. Oh my gosh, all of these processes are going to help us meet HIPAA compliance. Wow, cool, let's get it done. Now, finally, is the enforcement rule. Now, the enforcement rule publishes, and the latest one was 2016. I guess it takes them a long time to update the date. But they publish what has happened, who was hacked. And if you look at it, it's impermissible uses and disclosures is number 1 or number 2 for the 4 years of the report that I was able to pull. By the way, this is off the HIPAA website itself. And that information is our number 1 issue. Number 2, clearly appropriate safeguards. And number 3, proper access. And you'll notice minimum necessary is not the biggest problem. So we are clearly meeting that. And it's also not the technical safeguards. That's the last issue on the list. So from a technical standpoint, we're meeting everything, we're doing it right, but we're breaking it on impermissible uses and disclosures, we're breaking it on proper safeguards, and we're breaking it on access. Our top 3 mechanisms are the specific mechanisms that a DevOps approach ought to arrive at. And so that's why we're focusing here, that's why we're pushing here. And so the question is, how can we help, right? We want to change the way you guys do your work so that you meet the HIPAA requirements, so you're protecting the systems under management. And so what do you got to do? Well, first off, we want to make sure that you're finding the servers, finding the data, finding the information that is under your management. And second, you're classifying it. You're breaking it down, identifying which stuff is HIPAA compliant, needs to be HIPAA compliant, which stuff is patient information, which stuff is billing information. Then setting up protections in place in order to arrive at a DevOps approach, and then finally monitoring it all to keep a track of what's going on. And so what do we do for Discover? Well, we've got a tool. It's called a State Manager, and it will track down servers under management and allow you to control them in groups and monitor them and label them and literally say these are production, these are not production, these are online, these aren't, and see what's going on with your entire estate of servers under management. We've also got a tool that's going to let you classify the data, determining which stuff is HIPAA compliant, which stuff is not, and that's also built into the Estate Manager. There's more tools coming in this regard too, a whole bunch of them. I'm very excited by some of the things. I can't announce it yet, but we've got some really cool things coming up in this classify space. It's really going to be neat. Next up, we do have protection. Our data masking tool is fantastic. I have an article coming out shortly on how to do masking for credit cards in such a way that you can recreate a production environment in a non-production environment, but have it look and behave exactly the way a production environment would, down to the distribution of the data, not simply. By the way, credit cards, for those who don't know, actually have functional behaviors built into the credit card number. We are able to recreate that functional behavior and recreate data distribution in your non-production environments in order to protect HIPAA-style information. And finally, we've got mechanisms for monitoring databases. SQL Monitor has got wide-scale estate monitoring now. It does large systems, and between the reporting and the mechanisms to know what servers are online, what servers are available, when they were available, you should be able to meet and exceed the requirements of HIPAA in terms of knowing what's available and what's not and where things are at. So hopefully we're hitting these goals of achieving the visibility that we need to have, knowing what we have under management, knowing where things are going, so we can arrive at the right kinds of protection of the HIPAA information, and we can meet the compliance so that we avoid any kind of breaches, we avoid any kind of issues with the government, and we keep the data under management the way we're supposed to keep it under management. That is where we're going, and hopefully this has been a useful presentation. Are there any questions for anything that we've covered so far today? Well, cool. Then let me just say that we do have 4 events coming up really soon. September 5th, we have SQL in the City streamed. It's going to be a live event, but online. And we're going to have a whole bunch of Redgate people, including Kathy and Steve and Kendra, I'm very excited to say, are all going to be talking live on September 5th, and you get the information right there. Or if you want to have, if you're more into in-person events, we've got 3 events coming up in October, the SQL in the City Summit. And those are live and in person. New York and Chicago are free. The London event has a small fee associated with it. However, if you use the webinar, you can get a complimentary ticket. Oh, neat. I was going to tell you, I've got a secret thing that'll get you half off, but that's way better. So take that stuff and run with it. Wow, well done. So use webinar to sign up. Are there any other questions? Okay, well, thank you very much for attending. That's all we have for today. And with that, I'm going to stop the broadcast. Thank you a whole lot.